Welcome to the body scan practice for the St. Clair County RESA stress reduction course for those in human services. Before we begin, take some time to get yourself comfortable. To do the body scan, you can either sit in a chair or, if you prefer, lie on your back on a rug or mat. Wherever you choose to do this, make sure that you're comfortable and able to let the chair, mat, or rug support you completely. It's important that you arrange to do this practice in a warm and protected place, somewhere you feel comfortable and secure. It can be best to do this at a time when you won't be interrupted by family, pets, or phone calls. You can dress in clothes that are comfortable for you. And if it's helpful, you can see this as a time for you, a time for nurturing yourself or self-care, as an opportunity to be by yourself and with yourself fully. You might consider allowing this to be a nourishing time, a time to give yourself some positive energy and attention, a time to open the sources of strength and healing that are within you. I might suggest it might be helpful not to try to relax too hard. This sometimes creates unjust tension for folks. We're simply practicing or trying to be aware of each passing moment and accept, if possible, whatever is happening in yourself, looking at it clearly, simply because it is there in the present moment. Trying as best we can to let go of the tendency, which we all have, of wanting things to be different from how they are right now. Allowing things to be exactly as they are right now, and allowing yourself to be exactly as you are. So use these instructions for guidance, noticing your body and the activity of the mind as we go along. Treating yourself with kindness, letting go of judgment and critical thoughts. Just following along with the narration, attempting as best you can to be aware of how you feel and what is happening. There's no one right way to feel while you do this. The way you're feeling is fine. It's just the way you're feeling. Simply accept it. Giving yourself permission to feel whatever it is that you're feeling, seeing that it is okay. You can do the body scan in whatever position is comfortable for you. If lying on your back is not comfortable, then changing positions is an option. Trying as best we can to be aware of the intention and each movement if and when we do change positions. It's your sincerity and level of attention and not the way you're laying that is most important. Remember to breathe fully and to allow the breath to flow freely in and out of the body. So as we're here, we'll allow your eyes to close gently if you feel comfortable with that. Bringing your arms alongside the body with the palms open to the ceiling, legs outstretched, ankles uncrossed. Take a moment to feel the body as a whole right now, sensing the support. There's no need to hold the body right now. It is being held by the mat or the floor or the bed. Now, I invite you to bring attention to the fact that you are breathing. Not trying to change the breath in any way, but simply experiencing the air as it comes into and out of the body. Becoming aware of the abdomen rising as the air comes into the body and falling as the air moves out of the body. We're not trying to control the breath in any way, rather just becoming aware of the rhythm and flow of the breath. Noticing that as the breath flows naturally, the abdomen lifts with each breath and falls away as the breath moves out. paying attention to the breath moving in and out in this way. Filling the lungs with each in-breath, and on each breath, simply doing our best to let go of any intentions to feel a certain way, letting your body rest more deeply into your mat. If you become distracted or lost at any time during the exercise, you can bring yourself back to the breath. The breath can be an anchor for your attention. Now on the next out breath, directing your attention from the breath all the way through the body, coming to the left foot and directing your attention to the big toe of the left foot. Noticing any sensations here, perhaps feeling coolness or warmth, any sensations of air, the touch of a stocking or sock, perhaps feeling nothing. And if that's the case, simply registering that we feel nothing. Being with whatever's happening at this part of your body and moving attention from the big toe to the other toes of the foot. Aware of the skin and the nails, the space between the toes, any sensations of temperature, tingling, pulsing. And when you're ready, perhaps on the next out breath, moving our attention now to the ball of the left foot, the arch, the heel, maybe feeling the heel in contact with the mat, coming to the top of the left foot, aware of the skin, the muscles, and expanding your attention now to include bones and skin, all sensations. And breathing in as you could breathe right into the foot, and then breathing out from the foot. And breathing in, you might picture the breath entering the nose, passing through the throat and chest, down through the abdomen, past the hips and upper left leg, down to the left foot. And then as you breathe out, picturing the breath moving from the foot up through the lower and upper leg, hips, abdomen, chest, and back out through the nose. This is what we mean by breathing into a specific area of the body. As you breathe in, you might be bringing in newness and freshness, and breathing out, releasing any tension, any tightness, any intention to feel a certain way. Simply trying to let go if that is available to you. At this point, we might notice that certain feelings may be present in our awareness, pleasant, unpleasant, neutral feelings. When we experience something unpleasant or perhaps even painful in the body, we might think of different ways we can work skillfully with that unpleasant feeling. Some of the ways we can do that is noting the pain or the unpleasantness and returning. So at this point, perhaps if there was a pain or something unpleasant in the neck, oh, pain, neck, and then returning to the left foot as we were. Sometimes it can be helpful to name the unpleasant feeling and lean into it, or describe the unpleasant feeling in a more specific way. Oh, pain in the neck. There's a numbness. There's a tingling. Sometimes simply deeply exploring these unpleasant feelings may lead to the pain or unpleasantness fading on its own. And if that still isn't possible, repositioning as mindfully as possible, being aware of the movements and the intentions behind the movement, is also possible. Sometimes folks even need to step away from the practice for a moment, and that is perfectly okay too. The body scan should be a friendly practice of self-care, nothing that you have to do or be driven to do. So coming down to the top of the left ankle, aware of the bones, the tendons, the skin, and breathing into the ankle. Breathing in all the way down through the body to the ankle. And then on the out breath, picturing the breath leaving the ankle, moving back up through the body and out of the mouth or the nose. And when we're ready, we'll move on to our lower left leg, possibly feeling the contact of the left leg with the mat, aware of the skin and the calf muscle, the shin bone, any sensations in this part of the body. You might be aware of breathing into the calf and the lower leg and breathing out. And as you're ready, I invite you to move to the left knee, circling the knee joint with your attention, exploring the kneecap, cartilage, the hinge joint, the underside of the knee. Aware of any sensations here. As we listen deeply to any part of the body, we may experience strong sensations, unpleasant feelings. If we can just be with it exactly as it is, trying not to judge, being fully present to each sensation. And as we move through the body, releasing and letting go to the best of our ability. So as we're ready on the next out breath, we'll move on to the left thigh, becoming aware of the skin and muscle, perhaps feeling the pulsation and circulation here. There may be feelings of heaviness or weightiness, feeling the contact of the thigh with the surface you're lying on, aware of the thigh bone as it rests in the hip socket. And I will invite you to take a breath in, breathing all the way through the left leg, the thigh, knee, lower leg, foot, filling the entire leg and foot with freshness and newness. And as you breathe out, releasing any congestion, any tiredness. Another distraction that we sometimes face in the body scan is drowsiness. And some ways to work skillfully with drowsiness. If the eyes are closed, perhaps opening the eyes. We can also consider holding our left or right arm up above our head or simply out. Sometimes resisting against the inertia and gravity to lower the arm can provide a more awake or aware state in the mind. And ultimately, we can think about changing positions if we need to. If we're lying down, we could sit up. If we're sitting, we might stand. All these are acceptable ways of addressing drowsiness skillfully. And when you're ready, we can bring our attention now to the place where the thigh bone rests in the hip socket, spanning your attention across the hips and all the way down to the right leg, to the right foot, and now to the big toe of the right foot. Notice any sensations here, perhaps sensing coolness, dryness, moisture, tingling, or nothing at all. Noticing what is happening in your body right now. We can move our attention now to the other toes on the right foot, the skin and nails, spaces in between the toes, including all of the sensations that might be available to us. Coming to the ball of the right foot and the arch and the heel. Aware of the skin of the heel. Now coming to the top of the right foot, including the skin and the bones, and expanding the attention to include the entire right foot, the muscles, the nerves, the blood vessels, all of our sensations. And when you're ready on the next out breath, look at letting the foot go from our awareness and moving our awareness now to focus on the right ankle. Aware of the bones and the skin and the tendons, the feelings of contact the ankle makes with the surface that you're lying on. Simply breathing in and breathing out. Coming now to the lower right leg, possibly feeling the pulsation of circulation, aware of the calf muscle and the skin, the shin bone, and moving now to the right knee. I invite you to begin exploring the right knee, taking all of your attention and placing it right in this one part of the body. Noticing sensation on the underside of the knee, the hinge joint, the kneecap and cartilage. Well, we can begin moving now to the thigh, the upper right leg, exploring the muscle and the skin, perhaps feeling the pulsation of circulation. Aware of the thigh bone and taking a deep breath in, breathing into the thigh, the knee, the lower leg, ankle, and foot, filling the entire leg and foot with fresh energy and newness. And as you breathe out, releasing all congestion and toxins, completely letting the right leg and foot release. Bringing attention now to the hip bones, the entire pelvic bowl, possibly aware of the organs held in this part of the body, the intestines, and the reproductive organs, the bladder, the buttocks, feeling the contact of the buttocks and the lower back on the surface you're lying on. Noticing any sensations here, perhaps feelings of weightiness, perhaps feelings of lightness. Moving attention from the lower back up the spine, aware of each vertebrae of the spine, aware of the intricate nerves protected and encased in the spine as they branch out to all parts of the body, aware of the muscles and the skin of the back, allowing the muscles to ease and release with each breath. Moving further up the back to the middle of the back, possibly aware of the kidneys. Moving further up the back, bringing some awareness of the rib cage. Maybe feeling the rib cage expanding with each breath. aware of the place where the rib cage attaches to the spine. We might bring some attention to the back of the heart, back of the lungs, the shoulder blades. Drawing attention all the way up to the place where the spine meets the skull. Breathing in deeply, breathing fully into the entire back. Breathing into the lower back, the middle back, and the upper back. Breathing newness, freshness, lightness. And as you breathe out, releasing tiredness, tightness, and congestion. Simply breathing openness and ease into the back. And breathing out, allowing the back to rest more deeply into the surface on which you are lying. Moving the attention now to the abdominal region. Aware of the stomach. Perhaps feeling sensations of digestion. Possibly aware of the liver, the pancreas. Bringing some awareness of the intestines. Feeling the movement of the abdomen as it rises and falls with each breath. Taking a deep breath in. Allowing the abdomen to really expand on the in-breath. As the diaphragm muscles pushes down. Creating more space for the lungs to hold air. Notice how the abdomen rises as the body is filled with fresh oxygen. And then releasing, breathing out. Noticing the abdomen deflating, flattening. Breathing in new energy to the abdominal region, to the pelvic region, and the hip region. Breathing in, and as you breathe out, fully releasing. Moving attention now to the chest, feeling the expansion of the rib cage with each breath. Feeling the rib cage expand in the front, the sides, and the back. Bringing some awareness of the heart being cradled between the two lobes of the lungs. Noticing the close work of the heart and the lungs as the lungs draw in fresh oxygen. The blood takes it to all parts of the body and then returns what's no longer needed to the lungs, and the lungs release that all day long with each beating of the heart, with each in-breath and each out-breath. The body is constantly renewed, constantly beginning again. Perhaps feeling right now the beating of the heart or the movement of the lungs. Bringing some awareness to the muscles of the chest, the breast, the skin. Noticing the skin, noticing the collarbones. breathing into the entire chest, allowing the rib cage to expand fully on the front, the sides, and the back. Really drawing in fresh energy, filling the lungs, bringing new life, new energy into the body, into the chest, and releasing any congestion, any tightness in the chest region. Aware of any emotions that may come up in this part of the body. So often we talk about something being heartfelt or having a gut reaction. As we go through the body, we may notice different feelings come up, and being with whatever feelings come up, whatever sensations, whatever thoughts, simply noticing, breathing into the chest and breathing out, completely letting that part of the body go. One of the challenges that we often face with the body scan can be a wandering mind, and this is completely normal. The mind is designed to wander, often thinks about events in the future, events in the past. One way that we can sometimes work skillfully with the wandering mind is simply noticing as best as we can and noting what our mind is wandering to. Oh, planning for dinner. And then coming back to where we left off with the body scan. And trying to do so with some friendliness and kindness towards ourselves. So where we left off, as we draw the attention now down both arms to the fingertips of both hands, aware of the sensation of air touching the fingertips, possibly feeling moisture or dryness, aware of the skin of the fingers, the fingernails, joints of the fingers, the knuckles, palms of the hands, tops of the hands. Aware of the movement that is capable with the hands. You might consider breathing in to the hands and breathing out, bringing some awareness to the breath as it enters the nose and throat and chest, maybe moving down the arms from the shoulder to the hands, and then on the out breath, exiting from the hands back up the shoulders, through the chest, the throat, and the nose or the mouth. And moving to the wrists, aware of the bones and the skin, possibly feeling the pulsation of circulation here as the blood vessels interlace at the wrists. Moving up to the lower arms, aware of the skin and the muscle and bones. And coming now to the elbows, noticing any sensation in the elbows, the outer skin, the delicate skin on the inside of the elbows, or this hinged joint. Moving further up the arms, aware of the skin at the upper arms, the muscles, the armpits. Aware of the upper arm, the way the bones come together at the shoulder joint, And taking a breath in, filling the upper arms, the elbows, the lower arms, wrists, and hands. Breathing in newness, fresh energy. And breathing out any tightness, any heaviness. Simply trying as best we can to let go of any intentions to feel or be a certain way. Breathing into the arms, the wrists, and the hands, and breathing out. Bringing attention now to the shoulders, aware of the tops of the shoulders and the sides, the backs of the shoulders, noticing the muscles here. Really exploring any sensations in the shoulders and breathing deeply into the shoulders. Easing the shoulders, releasing any concern that has lodged in this part of the body. Breathing into the shoulders and breathing out. Letting the shoulders go. And as you're ready on the next out breath, moving our attention now to the throat. Aware of the ability to swallow and speak. To draw breath into the lungs. Bringing attention now to the neck and the muscles there. The vertebrae connecting to the skull, the neck holding the head. Taking a breath into the neck and throat region, and breathing out, releasing. Moving attention now up the back of the head, aware. We're bringing our awareness to the skull bones, to the scalp, the tiny muscles of the scalp. Aware of the follicles of the hair, coming further up the head to the crown of the head, the top of the head, and now the forehead. Bringing some awareness to the ability to smooth the forehead from one temple across the forehead to the other temple. Exploring any sensations of the forehead. And moving into the entire face now. Aware of the eyes, the eyebrows, the eyelids and lashes, the eyeballs resting in their eye sockets. Aware of the nose, the bridge of the nose bone, the nostrils. Taking a breath in through the nose. Sensing a feeling of air coming in. Perhaps cool, and perhaps leaving as warm air at the nostrils. And possibly feeling the movement of tiny hairs inside the nostrils. You can bring some awareness to the cheeks and the cheekbones, the sinuses, skin of the cheeks, and the many muscles of the face. Muscles which give expression to even the subtlest of feelings. Bringing some awareness to the ears, the ability to hear, the outer ears, the inner ears, the process of hearing in this very moment. Aware of the jaw, the hinge joint on either side of the face, the muscles, the jawbone and the chin. And coming now to the mouth, to the lips, the inside of the mouth, the teeth and gums, the roof of the mouth, perhaps the tongue resting on the floor of the mouth, and breathing into the entire face, breathing in freshness and easiness, breathing out any tightness, any tension, allowing the face to relax, to simply be in this moment, aware of the brain inside the head. Breathing into the entire head, breathing in freshness and breathing out tiredness and congestion, fatigue and worry. And as you're ready on the next out breath, I invite you to bring some attention now to the crown of the head and imagine that energy can be drawn in from the crown of the head, filling the entire body, breathing in from the crown, breathing into the head, the neck, the shoulders, the arms and hands, breathing into the torso and upper torso, lower torso, legs and feet, and breathing out at the soles of the feet, allowing the body to breathe as a whole right now. Breathing in from the soles of the feet, filling the feet, the ankles, the lower legs, the knees, thighs, hip region, lower back, abdominal region and middle back, chest region and upper back, filling the hands and wrists, the lower arms, elbows and upper arms, the shoulders, neck, throat, the face and head, and breathing out again at the crown of the head. Breathing in newness, freshness, well-being, bringing in the ability to be present in this moment, to be with the body as it is, to be with the feelings as they are in this moment. Breathing in newness, life-affirming energy. Breathing out tiredness and any energy that's no longer needed. Any stuckness, anything that's held, that's not necessary any longer. Breathing in at the crown of the head, filling the entire body, breathing out at the soles of the feet. Then breathing in at the soles of the feet, filling the entire body, breathing out at the crown of the head. Taking a few moments in your own time to breathe fully through the entire body, allowing fresh energy to wash through the body, and on each out breath releasing, letting go of what's no longer needed, allowing it to be like waves of the ocean coming into the body and releasing from the body. With each in-breath and each out-breath. As you breathe in this way, being aware of the body as a whole, as complete, as beyond its parts, allowing yourself to simply exist in stillness, the silence, the wholeness. And as we come back now to the body, beginning to move the fingers and toes, moving and stretching in any way that feels right to you, to bring yourself back to the room where you are right now, not rushing, not hurrying, just moving, stretching easily. And as you feel ready, opening your eyes, allowing the calm and centeredness to stay with you as you resume all the activities of your day. You might even consider congratulating yourself, paying some gratitude, remembering that this state of clarity and relaxation is accessible to you by simply attending to the in-breath and the out-breath at any moment in the day. It's a source, or can be a source, of balance and well-being. Allow it to be a source of energy and strength for yourself.